Well, thank you so much for staying with the Monday Report. You're just in time for the town hall session. Like we mentioned, send in all your vaccine questions at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. You can also send in some of your videos really quick right now before the next hour elapses. All right. Joining me now in studio is Dr. Collins Tabu, the head of the National Vaccines and Immunization Program at the Ministry of Health. Thank you so much for staying with us and being patient, Daktari. Let's start off this directly. So if someone had COVID-19 and has now just turned negative, maybe in the last 12 days, can they be vaccinated immediately or must they wait, and for how long?
Thank you, Trevor, for having me. If someone has had COVID-19 infection, confirmed COVID-19 infection, there are two ways to look at it. You want to wait at least 2 weeks after you've completely healed before you can receive the vaccine. You will for sure benefit from that particular vaccine. The other way to look at it is to wait at least 4 weeks from the onset of symptoms. If you're not too sure at the point at which you're completely healed, you'd count at least 4 weeks from the onset of symptoms. Within the first 2 weeks, you probably are in the healing process, at the end of which you're not probably infectious, after which you're in the recuperation period, and you don't have a chance of confusing any particular side effect, whatever it is that might come up with the COVID-19 infection symptoms themselves. Yeah. So we recommend 2 weeks until after you've healed completely, or 4 weeks from the onset of symptoms.
Was this reviewed? Because before that there was a circular that was saying that you need to wait at least 6 months.
I think that may have been misread. Yeah. We didn't have such a circular, at least from the Ministry of Health, but there's been a lot of guidance from different circles, global level and so forth. Yeah. So I wouldn't be mistaken if one of those was picked from such contexts. Okay. Yeah.
Can you be vaccinated if you have pre-existing conditions like hypertension, diabetes?
Yeah, for sure, Trevor. Those pre-existing conditions really place you at a risk of death or severe disease from COVID-19 infection. Yeah. And that is the very, very reason why you really a priority for us for vaccination, to protect you from severe COVID-19 disease and death from COVID-19 infection. So yes, you need the vaccine more than anyone else.
Yeah. So what are the most common side effects that you've seen so far?
Yeah, Trevor, the most common side effects we've seen are expected. They're not untoward. They're actually expected. And I just want to share with you before I enumerate them that they are expected and they are part of the body's response in developing immunity. So they are part of the immune development process, and they're really expected from the vaccine. So you really expect, and we have seen quite a number of people having a bit of fever, chills, a bit of body pains, a bit of headache, some numbness and slight pain at the site of injection. Some people have reported having some tummy upsets, a bit of nausea, a bit of loose stool, and so to speak. Yeah. So those are expected. Some muscle pains, just a bit of weakness, but they last just about 48 hours or within the shortest time after the vaccine administration. Yeah. So just again, those mild, minor side effects are expected, and that the body's response to the vaccine, it's actually a signal that your body is developing, is responding to the vaccine, is developing immunity. Yeah.
Should you treat those side effects? Like if I have a headache, can I take paracetamol? If I have a fever, should I treat them?
You don't necessarily have to treat unless when they are a bit severe. Severe in the sense that you're not able to function normally with those side effects. Then you may consider treating them. Yeah. Remember, some of the treatments we consider might actually interfere with the normal functioning of that particular vaccine. So that is why we do not, for instance, take Panadol ahead of the vaccine in anticipation of a side effect, but rather would try to manage as normally as possible until such a time that maybe the fever is a bit too high, the headache is a bit too much for you to bear, then you can take those drugs.
So wait a minute, explain that a bit. So if I have a severe fever, that's the only time I should take the medication. If I don't, if I can sustain it, I should not. But then how would I know this is severe?
If you have a mild fever, your temperature is about 37.5, you perhaps just need to undress, not to dress very heavily, perhaps expose yourself, perhaps run a bath that will calm calm you down and observe for some while.
Yeah.
But if the fever is a bit high, perhaps going to about 38 degrees, then you do realize that you may need to take it down with maybe paracetamol, or so to speak. Again, at that level, we may want to encourage you to get back to the health facility that you're vaccinated in, or any other health facility, be able to report that you had been vaccinated and you're feeling this ill, so that you can be evaluated and treated accordingly, and also that it can be documented.
Yeah. We've seen reports where people have reported deaths after vaccinations. Is this something you've seen as well, and what is the response from the Ministry of Health?
So what we have seen is reports of deaths from social media. We are investigating, Trevor. From the system that monitors the adverse events and that is captured, that is an online platform, and that is also reported from the health facilities, we by and large have close to 307 actually, minor or mild side effects reported. We do not have any deaths reported within that particular system, but we take any reports of death like we have seen within the social media very seriously, and we are investigating.
Yeah.
As I talk about this, just to share with my fellow Kenyans, is unlike the routine vaccines which are given to children or individuals that are well, please note that the COVID-19 vaccines are given in the background of 1, someone who is elderly, 2, someone who is already very sick from chronic conditions, 3, these vaccines are being given in the middle of a pandemic. So all these 3 things really place you at a higher risk of some certain of ill health, or at a higher risk of death compared to someone who is younger. And beyond that, COVID vaccination does not preclude the other health events that you'd otherwise go through. So we're already starting from a background where people have some chronic or severe illnesses, and we're vaccinating them. So any health event or death that happens within that particular group may not necessarily be attributed to the vaccine, but we investigate, and more often than not you find there are other situations that are associated with that particular condition.
Yeah, there's some arguments from some people, and I've seen it also on social media, saying that, vaccination really has an aspect of introducing that same virus in low quantities for the body to then build the immunity to fight it.
Yeah.
But if you're exposed, then vaccinated, can it then aggravate the infection?
Not necessarily.
Yeah.
I just want to correct one. Vaccination does not introduce the virus.
Yeah.
It introduces parts of the virus, either an inactivated, a dead virus, or it introduces some proteins that are taken from the virus itself, or it introduces some modified parts of the genetic material of the virus, so that the body can be able to recognize it.
Yeah.
So vaccination itself will not make you sick. It will not cause you disease. It does not cause you infection. So number 2, given that vaccination as a process, the process of you developing immunity, the immune response to the vaccine comes with some symptoms. We've seen you might have some fatigue, you might have some fever, and all of that. You can imagine that you are already unwell with COVID or something like that, or unwell with another medical condition, and then you have that bit of immune response where your body is actually responding to this vaccine. So it might seem to be aggravating the symptoms, while the truth is that it is your body actually developing. It's the immune response of your body that is exhibiting these mild symptoms, and it's actually not necessarily a bad thing.
Yeah. So should then be people get tested before they get vaccinated then?
No. There is no need to be able to be tested before you get the vaccine. First of all, why would you want to test before someone gives the vaccine? Because someone will have a bit of fever? Not quite. If we gave you a vaccine and you had you had the infection ongoing, it's probably of no consequence in terms of some adverse outcome. The only reason we say if you have the active infection, you need to wait at least 2 weeks after, or so to speak, it is because if there is any outcome from your infection, if there is any perhaps prolonged fever, if there's any disability, if there's any symptom that comes from infection, you don't want to be left confused, wondering whether it is coming from the vaccine or coming from the infection. Actually, that's a simple reason why we don't give the vaccine at that particular time, but not because there's any other consequence to vaccination at that particular time.
Okay. So can one get the second dose before the 8 weeks that is recommended?
Yes, it is possible you can get the second dose before the 8 weeks. However, I want you to note that the recommended period for us to be able to get the vaccine for us, the second dose of vaccine for us, is between 8 to 12 weeks. The second dose is most effective given later, say at 12 weeks as policy. If you receive it earlier, it will not cause you any harm. However, the protection from that, the added protection from that second dose will be less, say somewhere around 60%, compared to if you received it later, maybe at the end of the 12 weeks, taking it up to upwards of 90%. Yeah. So it is recommended that you delay and receive the second dose anywhere between 8 to 12 weeks of following the first dose of vaccination.
Yeah, I met someone who was telling me that the cold flu vaccine that they took is ending in March, and they've also taken the COVID-19 jab in March. Should they take them together? Do we know how those react?
No, we do not recommend you taking the COVID-19 vaccine together with another vaccine. Yeah. Remember, this is an older vaccine, a new vaccine. Some vaccines are live vaccines. This is not a live vaccine. We do not want to encourage you to receive them together. If you must receive another vaccine, then you need to space the two vaccines to be at least 14 days away from each other. Okay. For instance, if you have received the flu vaccine today, please wait for 14 days before you receive the COVID-19 vaccine. Or if you've received the COVID-19 vaccine today, please wait for another 14 days before you receive the flu vaccine or any other vaccine for that matter.
Okay. Yeah. So now that we are running out of the vaccine in 10 days, what is the plan from there? Are we fast running out of the vaccine? Because, you know, sometimes Ministry of Health and we read from different scripts.
Could I put it a bit differently?
Okay.
We have actually run the race so that we run short of this vaccine.
Okay.
Our objective, first of all, in the first instance, was to quickly boost the immunity of the most vulnerable populations. Number two, remember these vaccines have a short expiry, just like the flu vaccines. They have a lifespan, a shelf life of between 3 to 6 months. So you want to administer the vaccines, to scale up vaccination, to have a high consumption so that you administer these vaccines when they are most effective, before they are nearing the end of their shelf life. So we didn't have the luxury of saying, let us spread out this vaccination exercise so that these vaccines last us until the next shipment. For us, it's a good thing that we actually utilizing these vaccines and protecting Kenyans a bit early in the pandemic. Yeah. Let us take on the burden of trying to look for the extra vaccines. And our leadership has pronounced itself on this matter, and they're engaging beyond the current COVAX facility to assure that Kenyans get the vaccines and they are protected. As I'd like to share with you today, the current scope is for us to increase the number of people we're targeting for vaccination from 15 million to about 26 million Kenyans, number one, and to shorten the time period in which we expect to reach these people backwards from 2023 to mid-2022, so that we should have reached these 26 million people. The principle is we want to reach these people as fast as we can. We want to be able to resume normalcy. We want to be able to cut out the deaths that you're seeing on media today. We want to be able to reduce on the severe disease that you're seeing in the hospitals. We have a lot of beds occupied by COVID-19 patients. And you do acknowledge with me that perhaps road traffic accidents, people who are sick out there who need these beds are missing out and dying in the community because the beds are actually occupied by individuals who are severely sick from COVID-19. Yeah. So these will assure us protection of the communities, but also ensure that we resume normal functioning of the economy. Yeah. So this means we must vaccinate quickly. This means we must spare no effort to secure more doses of the vaccines to be able to to reach all these Kenyans that we want to reach.
But when are you expecting the next consignment then? And how many will they
from the COVAX facility, we do the Gavi COVAX facility, the next consignment is expected in May.
Okay.
But there is engagements that are going on as it is now within the Africa Union. There are bilateral engagements going on to ensure that we get other vaccines ahead of time to bridge the gap ahead of the arrival of the COVID vaccines.
Okay. And now, are you satisfied with the vaccine uptake so far? You mentioned it earlier on there. Because we heard that there are some, especially the military teachers, the uptake has been rather slow.
I am actually satisfied with the uptake of these particular vaccines.
Yeah.
As I speak today, we have vaccinated 25,000 Kenyans with this particular vaccine.
525,000?
Yes. We have distributed 999,000 vaccines from the national depot. So we're holding just about 100,000 doses of vaccines there. So you can see that we just have about 450,000 vaccine doses in the pipeline held between the regional depots, the sub-county depots, and the health facilities, and these are continuing to be used to vaccinate Kenyans.
Yeah.
We're going through process of redistribution to get these vaccines availed where they are needed most. Understandably, there are places where we have many more numbers turning up. Like you do realize, Nairobi is leading the vaccination. We've reached close to 180,000 people within Nairobi, followed by counties like Kiambu, Uasin Gishu, or so forth. So from where we sit, we are satisfied with the uptake of the vaccine, and Kenyans are quickly realizing it is much easier for us to be able to prevent against COVID-19 than to live with the consequences of the natural infection.
Okay. So what happens to those who jumped the queue, so to speak, and got vaccinated? Will they get the second dose?
Yeah, it is undesirable. It is a bit unfair, but they are Kenyans, and we want to maximize the protection. So yes, they'll be able to get the second dose, but we're trying to, as much as possible, discourage that and have everybody turn up for vaccination when they are due for that particular jab.
Okay. We have some questions coming in here. Francis Mutegi says, if I take the first dose and that particular vaccine is finished, or it takes more than, say, 4 weeks, and my second jab is due, can I take a different vaccine for my second jab?
No, unfortunately not. The vaccines as it is now are not interchangeable. So we as we move on, we're making every effort to ensure that the Kenyans who've been vaccinated with, for example, the AstraZeneca, are able to get the AstraZeneca vaccine to complete the immunization schedule. Okay. If it so happens that this particular vaccine you began with is not totally available, then you may need to restart the schedule with a different vaccine. Okay. Again, while I'm on this point, part of the engagements through the Africa Union is focusing on the Johnson & Johnson vaccine, for which we have just one dose, and that is almost equally as effective as the AstraZeneca vaccine. So perhaps that will get us out of this rut of saying, you know, I started with this vaccine schedule and now I want to complete with that. But that's engagement that is still ongoing as I speak. Yeah.
Lionel Mwangi says, me and my wife have been searching for this vaccine for the last 2 weeks, but all in vain. Where can we be vaccinated? We are over 58 years old. Unfortunately, Leon, you should have mentioned where you are right now. But where can people go get the vaccines generally?
So, thank you. Generally, the vaccines are being availed in all Level 4, Level 5, and Level 6 health facilities countrywide. And these facilities could be public, private, faith-based NGO at no cost at all, regardless of the facility you're visiting. So Leon needs to check within the context of his county, see which Level 4, 5, 6 health facilities have been availed. Yeah. This list, has been published out there from the national level, and we can be able to share it publicly. Okay. Beyond this, within the counties, they are deploying targeted outreaches to special populations or to places where they want to avail the vaccines closer to these people who most likely are elderly and may not travel out. Yeah. So we may need to keep tabs with the particular county you're located in, just to see what the outreach schedule is and to see how most efficient, how you can be reached most efficiently with this vaccine.
Okay. Alex Girinya So is there any effect if someone misses the second dose of COVID-19 vaccine?
Yeah, we do, in as much as possible, recommend that you finish the immunization schedule. There is no effect if you miss the second dose. However, please note that you will not be fully protected. The first dose of the vaccine primes your immune system and gives you close to 76% protection from severe COVID disease and death from COVID-19 disease. Yeah. We need the second dose to be able to boost and make that protection longer. So if you miss the second dose, it therefore means that you may not be protected as effectively as you would with the 2 doses.
Okay. Yes. J.K. Mwatha is asking again, could you ask again why Kenya is not able to produce the vaccine, yet Rwanda can?
No Africa country is currently producing the COVID-19 vaccine. Kenya has capability, just like Rwanda is trying to set up the capability to produce these vaccines. The conversation Rwanda is having in public, Kenya has been having for the last 3 years, and very soon you will see this coming through in terms of local vaccine manufacturing. Like I did share, local vaccine manufacturing is an intensive exercise. It takes a lot of financial resources, technical expertise. We need production expertise, but beyond that, there's a lot of quality management systems that we need to put in place, and there's regulatory requirements that we need to put in place. We have all those for us here. So what the country is doing is to engage further, to have a technology transfer partner and set up that particular enterprise to continue running as it is.
But is it then possible that now Rwanda can leapfrog us? In as much as we've been doing this for the last 3 years and they're just talking about it now, is it possible that they leapfrog us and be the first ones to produce vaccines here?
Well, I do not have visibility to whatever level they are within their engagements, but I do not see that happen. I think we are a bit way ahead in terms of our capabilities. And in terms of vaccine manufacturing, again, there are various steps. You may look at vaccine manufacturing as manufacturing right from the active ingredients, which takes a longer time. But sometimes the most cost-effective approach is to first of all have what we call the fill and finish plant coming in, where you import the active ingredients and finish off the vaccine, the vaccine development. Then later on, progress biotechnologically to being able to make up with active ingredients and all of that.
Okay. Yeah. To take a quick break here on the Monday Report Town Hall session. It's happening right now. I see a lot of your questions. Grace Story Teacher, see your question. I'll be posing them in just a bit. Also send in your video questions, and some of them are already with us. We'll be posing all that to Dr. Collins Tabu in just a bit. Stay with Monday Report.